So related to COVID-19 activity, as I'm sure you're all aware, on July 6th, the Chief Medical Officer of Health for Ontario did announce that Ontario is in the 7th wave of the COVID-19 pandemic, or also can be referred to as the third Omicron wave. This wave is being driven by the Omicron subvariant, BA.5. BA.4 and 5 first really emerged out of South Africa and then started to be seen in other countries. Similar to how it's worked in previous waves, you essentially have a new variant or subvariant that is more infectious than the previous one. And so it slowly pushes out the previous variant or subvariant to become the dominant variant. In Ontario and Canada-wide at this point in time, BA.5 is the dominant variant that we're seeing in all of our whole genome sequencing surveillance work. We know that BA.5 is more transmissible or more infectious than the previous Omicron variants, as well as the previous variants prior to Omicron. We also know that the risk of reinfection is higher. So if you had COVID-19 from Omicron, either BA.1 or BA.2, or you had COVID-19 from another variant, you can still get BA.5. So the risk of reinfection is there. We know that the vaccines still provide good protection against serious illness from COVID-19 with the BA.5 variant, certainly from what we've seen in other jurisdictions. And it does seem that the BA.5 variant does not cause more severe disease. So similar severity of disease to other Omicron variants that we've seen for the last 2 waves. Now, I think it's important to remind everybody, and it might sound like a broken record because we said this with the last wave and the wave before, that even though the Omicron variant and subvariants, including BA.5, don't cause as severe disease as the earlier variants, because it is so much more infectious, the absolute number of people that might become seriously ill requiring hospital admission may be larger than what we've seen. We hope, and I think the plan and the assumption right now is that the 7th wave will not be as severe or not cause the same number of hospital admissions as the 6th wave or the 5th wave. Those assumptions are primarily based on the amount of immunity we know we have among the community, whether it's by some more recent natural infection plus vaccination, which does provide some good, robust protection against serious illness, and the fact that it's summertime and people hopefully are not gathering in as large numbers indoors, which puts the risk of transmission or spread of COVID-19 higher. So we should expect, certainly locally over the next couple of weeks, to see an increase in activity, including in hospital admissions, but hopefully not as significant as what we saw with the last wave. That being said, I think it's also important to be aware that our hospital system is already under tremendous strain due to a number of factors, including shortages in nursing physician and other allied health staff. So really any increased burden on the healthcare system contributes to that strain and puts pressure on the system overall. So as much as we can avoid really any strain on the healthcare system, we want to be doing that. When we look at the spread of BA.5 provincially, so we know that provincially all of the indicators have been increasing. There has been an increase in the number of new lab confirmed cases, increased in wastewater viral signal throughout many areas in the province, an increase in the number of outbreaks, and an increase also in the number of hospital admissions being noted provincially. This is not being felt equally across the province at this point in time. Our colleagues in Eastern Ontario, and in particular Ottawa, are experiencing a more rapid increase in case activity, with test positivity approaching 20%. Locally here in Haliburton Kawartha Pine Ridge District Health Unit, we are just seeing very early small increases in the indicators that we typically follow. We have seen a very small uptick in wastewater viral signal in both Lindsay and Cobourg, but very, very small, nowhere near where it was in the last wave. A reminder that the wastewater surveillance data that we receive here has about a 5 to 7 day lag period. So we're always a little bit behind with the data we have from wastewater surveillance. Our test positivity is increasing. We had gotten to a number as low as 2%, and we've inched back up to around 9% for our test positivity. To put this in perspective, our test positivity increased to about 22, 23% at its highest level in the first Omicron wave back in January. We have had a small increase in the number of outbreaks attributed to COVID-19 and are currently managing or supporting 4 outbreaks. Again, to put this in perspective, at the peak of the last wave, we were managing 23 outbreaks at its most intense point. We have not seen a significant change in the number of hospital admissions we're seeing. We are still and have continued to see a steady trickle of new hospital admissions from COVID-19. As I understand it, there are currently 4 individuals that are residents of HKPR admitted to hospital. So we are still seeing some severe illness, and this may increase over the next couple of weeks as we see a bit of a surge in COVID-19 transmission. I think we're certainly having questions related to how are we going to approach this current wave. And really, it's the same key messages. And I already sounded like a broken record earlier in the session. It's going to happen again. Those key points of ensure you're up to date with your COVID-19 vaccinations, stay home if you're sick. If you have access to a rapid antigen test and you're sick, do an initial rapid antigen test. If it's negative, don't assume that you don't have COVID-19. Repeat that test 24, preferably 48 hours later to see whether or not it has changed. I do strongly recommend, as we're seeing an increase in activity, that people wear a well-fitted, tightly fitted mask if they're attending indoor gatherings that are crowded or you're not able to maintain space and you're there for a longer period of time or more than 15 minutes, essentially. And also for those folks that are at higher risk of more severe COVID-19 illness, to very seriously be considering wearing a mask for any crowded outdoor gatherings or for individuals that might live with or work with those at higher risk for severe COVID-19 illness.